Hello. Just waiting on some people to hop on. I feel like I kind of have a lot today, so I'm going to try to get through as much as I can without droning on forever and ever. So, okay, we'll go ahead and get started. So, just a brief update. We're still at 33. I want to just point out that 4 of those 33 are still active cases. So I know there's a lot of thoughts and concerns around the numbers, but what I want to impress upon you is to not be as concerned with the overall number as how many are active and where did those cases come from. So right now the data does not support community spread, and that's good news. We are also seeing a continued decrease in ER data regionally. So that's also good news that we're headed in the right direction, but still want to be vigilant. I'm going to talk a little bit more about that as we go on. But so more than 1,000 people have been tested for COVID-19 in St. Francis County. So those numbers are going up significantly, and that is great news because the more people that are tested, the more we can identify cases and isolate and quarantine the people who are appropriate and do good contact tracing. So those are good things. I know there are many questions around the numbers and how things are counted. Cases are counted based on a lot of things, but CDC has criteria that we use for case counts. To be a case, you have to meet case definition. So that means you might have to have specific laboratory criteria. You've got to have specific symptoms. You might have to meet some exposure criteria. So there's a whole list of things that we have to consider when we're classifying cases, whether that's a possible case or a case that is confirmed. When you see the cases that show an epi investigation link, what that really means is it's a case that typically is associated with another case, somebody that's a household contact or a very close contact to someone who also has the same symptoms in the same incubation period. And again, there's a lot of things that go into identifying those cases. This epidemiologic work is very intricate, and we use the guidelines that have been given by the CDC and the Missouri Department of Health to classify cases. So that's how that works. And, if you have questions about reporting or anything like that, I encourage you to reach out to our nurses. We can't talk about specific cases. We can give you the information that we're giving every day as far as some of those basic demographics, but we cannot talk about specific cases, and we cannot, give information that could potentially identify these people. And so that makes it really hard to understand exactly what's happening here. But just letting you know, those numbers are important, but just like we've talked about before, we know that there are likely cases out there that have either been asymptomatic and didn't know it, are not sick enough that they felt they needed to go to the hospital. And this is similar to other communicable diseases that we investigate. We know there's way more salmonella out there than we know about, but if those people don't present for testing and are subsequently positive, we won't know about that. So I just want you to keep in mind that, we are doing our epidemiologic investigations and contact tracing. And right now the data is pointing in a good direction. And that's the same for Missouri and even in St. Louis, where they do have community spread. They're seeing improvements in numbers, and those are all good things, but we still have to be vigilant. So I want to talk a little bit about, I know we've talked about this a lot, but the differences in Missouri's reporting numbers and our reporting numbers. We enter into a database for Missouri. We've talked to them a lot about the differences in numbers, and it's different for other counties as well. So it really just depends on how they pull data. And I think there's a disconnect between us and them at times, and that's being worked on. But I will say that because we get the reports for positive cases, they're required by law to report to us, we have the accurate data in real time. So that's important to know. I've got a lot of stuff here, and I just want to make sure I hit all of it. Okay. I want to talk a little bit about the Show Me Strong recovery plan, because I think there's some confusion about gathering limits. A couple of things. There is no gathering limit in the state of Missouri. it says that large venues can operate if they are able to maintain social distancing. So I just want to make sure that that is known. That plan is linked on our website. And really, again, the most important thing is that we're social distancing, and large crowds are certainly hard to control and to ensure that. And we want to, as a first step, work with businesses to help them, give guidelines, to help them strategize, provide technical assistance. We can't, do it for them, but we can help them on their paths. And that's what we want to do as a first step. And we're working on some other things with other county offices. But we need to keep in mind, again, that we are under the Missouri order, and that's what the Missouri order says for the Show Me Strong plan. Okay. Had a lot of questions about the pediatric multi-system, multi-inflammatory system, or syndrome, sorry. I'm going to mess that up. Kawasaki-like disease that New York has been talking about, and we've heard a little bit of news about. Pediatric multi-system inflammatory syndrome. Sorry, it's a mouthful. I'm going to link a couple things when we get off of the live to this video, but not a lot is known yet, basically. And that's why we haven't heard anything from CDC yet on this. And they think it's pretty rare, and they're not 100% sure that this is connected to COVID-19, but they suspect it. And so what they've seen is rarely in children, several weeks after they've potentially had COVID-19, may have not even known they had COVID-19, that they have sometimes developed this life-threatening syndrome. And so I'm going to link a couple things from the New York City Health Department, and then another article that I found from childrenshospital.org. That's just kind of some information for you to know about. But again, they think it's pretty rare. They're not quite sure if it's connected or not, but they think that it's possible. And it is a serious syndrome. So it's something that we want to be aware about. Most of the symptoms include a fever that is prolonged, so lasting several days, and then other symptoms such as irritability, sluggishness, abdominal pain without any other explanation, vomiting, diarrhea, rash, especially on the chest, hands or feet, red or pink eyes, enlarged lymph nodes on one side of the neck, red, cracked lips or tongue that looks like a strawberry, and then swollen hands and feet, which also might be red. So again, I'm going to link this New York City article just so that you can see it. But again, we need to proceed with caution and wait for some more information to come, but it's always good to be informed. So we will put that up for you to see. I just want to say before I get to a couple of questions here, it is important to share accurate information. And what I want to impress upon you is that we need to all ask questions. We need to question the things that we see. And that doesn't just mean, other things. That means us too. Question us. Let's have conversations to better understand what's happening with this and other situations that we deal with in public health, or even other realms of government. It's important to ask questions, but it's important to also know that extraordinary claims need to be supported by extraordinary evidence. And, if we don't have evidence to back up our claims, then it ends up being just opinions. And so I would encourage you to continue asking questions, continue to look for the resources to your questions that are evidence-based and credible. These are important things, and, it helps us all stay informed, but we want to stay informed with accurate information. So let me try to scroll back through. I know I see a lot of stuff coming through. A lot of hellos. Hello. Just trying to scroll through. I see just a lot of highs. Hi, thanks for being on. There's a long question that I'm reading. So people are starting to not trust the CDC and the health department. Then you have others with a false sense of security. My question is, why are the inconsistencies, asking about inconsistencies with numbers, knowing a family of 7 is symptomatic. However, numbers do not show that. What is being done to fix this issue? Is it for political reasons that the numbers are being kept down? Also, why was no one informed of the positive employee at Casey's? So again, I can't speak about specific cases, but let me kind of try to dovetail on some things that I said earlier. So cases are counted based on CDC criteria. And if those cases do not meet CDC criteria when we do an interview, so what is told to us in an interview, they won't be counted unless they meet CDC criteria. And that has to be told to us in an interview or supported with laboratory criteria. So let's keep that in mind. Sorry, my work phone's going off. But we should expect that if I was sick and, you know, I have a husband and 2 kids, if I'm sick, those people are at really high risk because they live in my house for getting COVID-19 or whatever illness that I have if it's communicable. So those people are high priority for being quarantined, and they are quarantined. So they're not out spreading this disease. So we expect that people are going to have symptomatic contacts. And again, the numbers that you're seeing are the numbers that are able to be defined by case definition from the CDC. That's how we have to operate under the state. And that's the numbers that you're seeing. But we know that there are people that are out there that are sick that are not counted in these numbers because we don't have the data to support that. That's why it is extremely important that we all continue to follow the recommendations of the CDC and health departments, local health authorities, and those really are, I mean, the things that we've talked about previously, and this was kind of my wrap up, but I'll hit on it as we go through. But hand washing, social distancing, when you're out in public, staying 6 feet away from other people who are not in your family unit, wearing a mask when you're out in public where you can't readily social distance. That protects other people. Again, we've talked a lot about asymptomatic infections. And again, when you're wearing a mask, you're protecting other people. When they're wearing a mask, they are protecting you. So it's important to continue to do those things. Staying home when you're sick. If you think you've got symptoms of COVID, you need to contact your doctor and have them screen you to see if you need to be tested. But all of those things are important because we know there's cases out there that, again, are either not sick enough to present to test or haven't been tested for whatever reason. And so we just really need to be cautious going forward. I'm trying to hit on this last part of this question. Again, if we can identify the close contacts of a case, we do not typically make a public announcement of that person's employer. Again, this is for privacy reasons, and as long as we can make sure we have the close contacts that we need to contact to let them know that they've potentially been exposed, then there's really not a reason to make a public announcement, because the people who are a priority are the people who are close contacts to those people. So that's people within 6 feet for 10 minutes, which is really a pretty long span of time. So those are the priorities to be contacted. Trying to scroll through here and see. So there's not a restriction on group size under the Missouri order. We suggest group limits of 10 still. That's in coordination with the national guidelines. But again, that is a suggestion. The mandate is that these groups should allow for social distancing. So social distancing, as long as that can be maintained, large venues can be open, weddings, funerals, all those things, as long as social distancing can be maintained. Trying to go down through here. Thank you. Okay. Yeah. I'm seeing some things that we've already kind of talked about a little bit. I see some questions about, again, specific cases. I want to caution you in what you're hearing, because what you may be hearing might be different than what actuality is. And so here, when we get a case, we contact trace every single case. And so we know who is in contact with them, because I see the question about the officer at St. Francis County. If someone is exposed, they will be tested, they will be quarantined, and they will be referred for testing if they develop symptoms. And so again, those priority contacts are the close contacts to that confirmed case. If we can't do that, or we feel that it's a risk because of a possible congregate setting, which is certainly a high risk, but again, it's hard to explain a lot of intricate details to everyone because we can't talk about specific cases because we have to be careful about privacy. So when that is necessitated, then we will do that. Do you need filters for homemade cloth masks? No, as far as I know, no, that's not been a suggestion from the CDC. So homemade masks are good for the general public to be using if you're out in those public settings where, again, social distancing is not readily available or not easy. Are Farmington parks open? I think parts of the parks are open, but not the playgrounds. But some of the cities are doing some things that are a little bit different. They know what the order is. I'm just looking at my clock for time. They know what the order is. So the order recommends strongly that playgrounds continue to be closed because of the disinfection piece of that. And so I would suggest, reaching out to the city of Farmington to talk with them a little bit more about that. Yeah, I see some people talking about masks. I'm trying to go through here. I'm going to try to get just a couple more questions, and then I've got to hop off here. Yeah, so if someone tests positive, do you offer any services for the family, like if both parents are sick? So again, this really depends on what's happening with a case, but we always offer resources if they're needed. We've also offered to deliver groceries to people. We have a lot of resources in the community, and then those people have to be, to take up those resources to use. But we do offer resources if needed, and it just really depends on how sick people are and what we can do to help them depending on the situation. But thankfully we have a lot of resources, and we've seen the community rally around some cases, and so we appreciate that. I'm gonna try to get one more question. Sorry, I'm reading as I'm asking. Okay. So this question is about testing positive, and it's up to CDC whether or not you're accounted. So if you test positive on a PCR test, a viral test, that PCR is a confirmatory test. That will be a case no matter what. But serology is not a confirmatory test. So that is up to interpretation depending on symptoms, depending on exposure, depending on the result of that serology test, whether it's an IgG or IgM. So that's where some of that CDC criteria comes in to classify a case as being what they call confirmed, probable, or suspect. And then the EpiLink, again, as I talked about that earlier, has to do with the exposure to the case, the symptoms, and when the symptoms developed in relation to the incubation period. So if somebody tests positive on a viral PCR for SARS-CoV-2, which is the virus that causes COVID-19, they are a case. And you can see that number broke down, actually, now that we have that broke down of PCR testing. So those are people who tested positive on a viral test for COVID-19, SARS-CoV-2, and that's a confirmatory test. So those people are absolutely counted. I know I promised like one more question. No new cases today. There's my last question I'll be able to take. I've got to hop off here. Appreciate you guys. Just want to encourage you to continue following those infection control things that we've talked about in the past. Please stay home if you're sick. I know that seems like something that's obvious, but it's tough for some people, and it's tough if you've got to go to work. But we really need people to stay home if they're sick. We need you to wash your hands, stay away from other people if you can. And I just want to, again, encourage the use of a mask when you're out in public. We've got to all work together on this. Nobody wants to head back to stay-at-home orders. I think we all want to head back to a version of normal life. And things are going to continue changing as more is known about COVID-19. We're going to continue doing live updates on Thursdays at 2 p.m. for as long as it seems like they're needed. I think our audience is dwindling down, so we'll just have to see, if it's needed. I want to say this real quick. we are going to decrease our updates for cases. We will update cases every day at 4 p.m. Monday through Friday, so our normal business days. If we are still going to be investigating on the weekends, if we get positive cases on the weekends, but unless something major happens on the weekends, you can expect our update to happen Monday through Friday at 4 p.m. And this is all in efforts to really conserve our public health resources. We have very few staff, and so we want to make sure that we are continuing to investigate, which is the most important thing, doing our good contact tracing. And again, if you have questions about how those things work, we can't talk about specific cases, but we're happy to talk with you about how all of that kind of fits together, because it's very intricate. And I think if you talk to any of our nurses, we love talking about communicable disease and infectious disease and the job that we do here. So we'd be happy to talk with you. We appreciate you. I will talk to you next week on Thursday.